So we are explaining the Chinese notation, and that is number 2, question 2, part 8, and we are going to explain the relationship between patient's data, visit records, treatment ID, malaria records, the healthy facility, the geographical location, epidemiological data of the patient, treatment outcomes, and then interventions, laboratory tests, everything, and how they are relating as far as this database is concerned. So first of all, we are going to handle the part of how patient data relates with visit records, and then yes, so without wasting time, patient's data it contains the patient ID, their names, date of birth, their gender, yes, and the visit records contains the visit ID, which is used by the patient every time they come to the facility, and then the patient ID, that one which is created from their data, then the visit dates, the different dates that they come to the facility for treatment, the outcome, and then the facility ID, if at all they are visiting different branches of the facility. Yes, so in patient's data, the patient ID is the first attribute. Patient ID is got from the is created after getting the data of the patient, which data is the names, date of birth, their gender, and then when we look at the visit records generated from the they are generated from the patient's data, definitely, yeah. And then these visit records depend on the visit ID, the patient ID, the visit dates, and then the outcome ID and the facility ID. Yes. So the visit records, the visit record containing the visit ID, which visit ID is created from their patient records or the patient's data, whereby this visit ID contains the patient's data, that is the patient name, their date of birth, their gender, the facility to which the ID belongs to, all where it was created from, and then we are now going to explain how visit data relates with geographical location, the referral, and then how it relates with treatment, and then the laboratory test. Yes. So with this case, the visit records mainly help in accessing the how this patient has been visiting the laboratory, which tests yes, how this patient has been visiting the laboratory for tests, how this which treatment was given on which date, and then which dosage, maybe which side effects were detected on specific dates, and then which interventions were made. When I talk of interventions, what I mean is which prescriptions were given to them, which visit number of this ID was used, and then how did they schedule their treatment. Yes. So when we go further to laboratory tests, how do they even now, because they now relate to the user. How do they relate to the user of the database now? So when I talk of the user, that is definitely the systems admin of the database. So the user now contains the user ID, their full names, their email, phone number, and then the password. On logging in, now the database is able to detect whether the person logging in is the right user, and then which dashboards are to be displayed to them. By this we mean if the user is the systems admin, it will display everything concerning the database, how people have how many the data, people's data, everything in the database will be displayed to the admin. But then if a person logs in as a patient, definitely, okay, let's say it's a patient logging in that database, all to put in different data, all it's a laboratory attendant now posting in some details of the patient, or it's a trainee now posting in their results of what they have conducted or whatever. So this database will then give them a different dashboard. Yes, so that is how this one, the laboratory and the user interacts between there. So we can now go to the training and the relationship between the training and the healthy facility. So in training, we have the training ID, training name, training date, completion status, and then the person who has added in that information. Then when we go to the healthy facility, we have the facility ID, the facility name, and then we have the location of that specific facility, and then the capacity it holds. So all these ones are very crucial when it comes to the database, because the database needs to know which number, which capacity is it holding, which location, so that it can be able to coordinate efficiently with a location or with the patients that have different let's say branches of the facility. Yes. So this one, the training and then the healthy facility, their relationship is not that very big, because the training or the trainee, their role mainly in the database of the healthy facility is just mainly to enter their records, their completion status, the training dates, the training name, and then the training ID specifically of that trainee, so that the healthy facility can be in position now to track which trainee is this one, their completion status is this, their training dates are this, and then what specifically are they training in. Yes. So in relation with the supply chain and the healthy facility, in supply chain we have the supply ID, resource ID, facility ID, quantity shipped, shipment date, and then the status. So this one is mainly dealing with procurement of the healthy facility. Let's say the facility needs to procure some ambulances, needs to procure some patient trolleys. So it gives them logical thinking about the decisions they are going to make in relation to their resources, all their shipment resources. Yeah. So this one, they base on this data from the database to know that we are going to bring 4 ambulances, we are going to bring 5 patient trolleys, we are going to bring different types of medicines, like that. So that is it mainly. Then when we go to the supply chain and then resource ID in relation to the database, this one just helps them to find out how many resources do we have, like the quantity of the resources we have in stock. When was it last updated? Which resource are we looking for? Which resource ID should we look for if at all we want to ship many, or we want to add in stock? Which one should we add? Which one is on the reorder level? What should we do? Like that. Yes. So that is it in brief relating to the CHENS notation database, ERD, the entity relationship diagram. Yes.